let me tell you a little bit about myself and what I do. I come from a little bit of a different perspective, being a pediatrician, so not many pediatric club red members here tonight. But that's okay, because I think most of you, or many of you, or some of you must know kids, right? Maybe your parents, maybe you're associated with a kid next door. And you see that there's been enormous amount of stress placed on children in our society. And I'm going to talk about that a little bit. But first, let me just tell you just a little bit about myself. So I'm a pediatrician. I'm a pediatric infectious disease subspecialist. Before I was here at UVA and working mostly just doing general peds, I was a program director for the pediatric residencies for about 15 years. And for the infectious disease fellowships, I ran the inpatient infectious disease service. I was a hospitalist. I did 9 vaccine studies. I was at the Center for Vaccine Development. I did a lot of work. I have 3 kids that all were pulling me in different directions. I have a very, very, very busy husband who also has 2 jobs, who happens to be here tonight, supporting me. He's wonderful, even in his busy job. I really thank you very much, because support and having friends and support is also a huge part of stress reduction. But what I'm saying is that I lead a very, very busy, stressful life, and what I have done with a lot of my professional practice is teaching. I teach the medical students, I teach the residents. And I've obviously been a director for a long time, and I've seen them over the years of residency in medical school getting more and more stressed out. And stress reduction management, or taking care of yourself, is not taught really in medical school. It's just like, do, let's take care of these patients, let's figure this out, let's put a Band-Aid on that, let's do this, and let's not really heal thyself. And I see a lot of stressed out young doctors. And I've taken this on as kind of a little bit of a mission of mine to help them out, almost like they're my kids, so pediatric in mind. I think it's really important. So I actually start a lot of my teaching sessions with some mindfulness time, some quieting meditation, a little bit maybe even some chair yoga before we do a teaching session, even for 5 minutes. And I will say to them, you have 5 minutes. You have 5 minutes to do this. That's all it takes. I had a very stressed out colleague actually this morning in my clinic. She was sitting next to me. She was dealing with a very troublesome patient, and she just came back in, and she had to go see another patient, and she was very stressed out. I looked at her, I said, sit down, you need 5 minutes. And we did some deep breathing, and I made her just do a few minutes of what we're gonna do inside, of some movement and some mindful movement. And she looked at me, she goes, oh my gosh, I feel so much better. And I was like, when was the last time you actually took a deep breath? And so I will say that to my patients, because they come in and they have problems with stress and schoolwork and this social situation and that social situation. How do they present to the pediatric office? They present with depression. They present with anxiety. They present with behavioral outbursts. They present with behavior problems. They present with self-injurious behaviors like cutting. They present with eating disorders. And if I could tell you how rampant this is in the pediatric office, you would all just like, oh, go home now. This is just terrible. And a lot of it is stress-induced. And they come in and they want, the parents want some medication to help them out and put them on an anti-anxiolytic or an antidepressive medication. And they work. They do work, and there's certainly place for medication, but you can also heal thyself from within. And so the same philosophy that I'm teaching my own kids, my medical students, my residents, I teach to my patients. And I look at them, I say, when was the last time you took a deep breath? When did you take a deep breath today? You have not. Sit down, take a deep breath, and we'll work on that. When was the last time you were a little bit mindful? What does that mean? And just teaching that, and I'll be honest with you, for those of you that are practitioners out there, this takes an extra 5 minutes in the office. It doesn't even take that much time. So people are like, how do you have the time to talk about this? Well, you have the time to talk about it as you're doing the physical exam, as you're talking to them. Let's be a little bit mindful. Let's quiet down. Because when they start quieting down, start taking those deep breaths, which we are going to talk about, you turn on your parasympathetic nervous system. Your parasympathetic nervous system is one of our pathways that we don't use very frequently. Oh, we do, but we live in a sympathetic nervous system overdrive society. We do, right? We're all like, yeah, let's go. And, you know, it's good if you have a tiger chasing you. It's good. We need it, right? We're happy we have that flight or fight. But not all the time. So you need your parasympathetic nervous system to kind of help keep things in balance. And that parasympathetic nervous system also directly impacts what's happening with your neurotransmitters. And the neurotransmitters that I'm talking about are your own feel-good hormones. They're serotonin, they're dopamine, they're GABA. It's oxytocin, it's melatonin. It helps you sleep. It's also helpful to take melatonin to sleep, but you can also produce it within with some mindfulness practices. And I use the word mindfulness practice. It all includes meditation. It includes deep breathing. It includes just taking a second for yourself while you open the door. It includes doing some mindful exercise, some gentle movement, some yoga, or some other exercise. It includes taking care of yourself with your community, with your friends, sitting down and actually talking to people. And the last thing I'm going to say is it has to do with what I see the kids doing also. And they come into the office, or I see them hanging around, and they're all on their little devices. They're all like this. And they're all like sitting at a table, and like they're all talking, but they're like talking. And I'm like, you're not even, who's at the table? What is going on here? Put that away. Put down the electronics. And I think that we are in such a high-tech society of keeping up, and it's not good. People forget themselves. And so this is what I see when I take care of my patients. I try to counsel them into paying attention. What I say to the patients and my medical students and residents is, you have to pay attention. That's what mindfulness is really about. And if you could really pay attention to yourself and to others, then you're with the program.